Hello friends, welcome to my channel Med Simply Learn. In today's short video, I will be discussing about the dual marker test. So what is this dual marker test? It is a screening test generally performed in the prenatal period for assessing the risk for chromosomal abnormalities. It is a non-invasive test and performed in the first trimester of pregnancy. And this test assesses the risk of chromosomal disorders like Down syndrome, Edwards syndrome, and Patau syndrome. So let's see what are the markers that are analyzed in the dual marker test. First marker is the papa protein, which is produced by the placenta, and it is low levels indicate the abnormalities. And another marker which is measured in this test is free beta HCG hormone. Again, it is produced by the placenta. And when this test is performed, it is performed between 11 and 13 weeks and 6 days of pregnancy. And to increase the accuracy of the dual marker test, we combine it with the nuchal translucency measurement. So what is the nuchal translucency? Nuchal translucency is a fluid filled space at the back of the fetal neck. As we can see in this image, at the back of the neck, this fluid filled space is known as nuchal translucency, measured during the ultrasound. And if it is increased, it indicates some chromosomal or a heart defect in the fetus. And this nuchal translucency is measured along with the dual marker test in the same time frame, that is between 11 weeks and 13 weeks and 6 days of pregnancy. Now coming to the interpretation of results of dual marker test. Results of this test are given as a risk ratio like 1 is to 250 or 1 is to 1000 etc. And how we interpret high risk or positive screening is given if the ratio is like 1 is to 100 or 1 is to 250. While low risk are the ratio which are more than 1 is to 1000. Okay. So if it is a positive screening test or a high risk test, it does not mean that it is a diagnosis for any chromosomal abnormality. It just means that the risk is elevated. So once we get a high risk result, we have to go for follow-up testing, and follow-up testing includes chorionic villus sampling, amniocentesis, or non-invasive prenatal testing, or the NIPT. Coming to the benefits of dual marker test, it is a screening test helps in detection of chromosomal risk early in the pregnancy. This is a very big advantage. Then second advantage is it is a non-invasive test, so there is no risk to the fetus, and thus there is no risk for any miscarriage. Also, it helps in taking informed decision as it guides the parents for further testing and take decision whether to continue the pregnancy or terminate the pregnancy. Finally, let's discuss the limitations of dual marker test. So first limitation is it is a screening test and not a diagnostics test. It only predicts the risk, does not give a confirmed diagnosis. Second important limitation, sometimes it can give positive, false positive, or false negative results. It is having a limited scope, does not detect all the genetic conditions. And finally, detection rate is also, accuracy is 85 to 90% for Down syndrome if it is combined with nuchal translucency. Thanks for watching. Do subscribe my channel and share my videos.